History taking in ophthalmology. Preliminary data. Name, age and sex, address, occupation, date of admission. For example, name Neil Hardman, age and sex 40 male, address 189 West 89th Street Manhattan, occupation, florist. Note that this directs us towards a specific direction. That's the importance of occupation in history. Date of admission. Chief complaints. Chief complaints should be in patient's words. They should be in a chronological order. That is, the one which appeared first in timeline should be written first. For example, diminution of vision in left eye since last 2 years. Watering in left eye since last 1 year. Pain in both eyes since last 6 months. History of presenting illness. Describe all the chief complaints. For example, diminution of vision can be described under following heads: onset, duration, progression, pattern. Pain can be described under heads: onset, location, duration, character, aggravating factors, relieving factors, time, severity. A mnemonic old cards can be used. For example, the patient was apparently well. Note down the time. Back when he started having pain in give and describe the location. The pain is, describe the character and aggravating and relieving factors. It is continuous/intermittent, etc. Subsequently he also started having diminished vision in left eye. It was constant in nature, and more for long distances than near distance. It is progressing. Negative history. Rule out factors. Ask for history of trauma, discharge, floaters, redness on white of eye, white on black of eye, insensitivity to light, photophobia, glare, halos, painful movement of eye, flashes of light. Micropsia, macropsia. This helps us in ruling out certain diseases. For example, if the patient says he sees something floating, it directs us towards a possible vitreous condition. Treatment history. Ask if the patient has taken any treatment for the presenting illness. This is important because sometimes a physician has tried first line of drugs and then the patient comes to you. It gives you liberty to directly use second line drugs. Past history. It is divided into 4 heads. Ocular medical, ocular surgical, systemic medical, systemic surgical. Ocular medical, ask about any previous disease of eye. Medications taken for it. Ocular surgical, ask if the patient has undergone any ocular surgeries before. If yes, take detailed history of that surgery. Systemic medical, ask patient about any significant systemic disease that he has. Systemic surgical, any surgeries in past. Ask if the patient has these diseases. Diabetes mellitus, hypertension, ischemic heart disease, tuberculosis, bronchial asthma, and drug allergies. Personal history. Ask for bowel and bladder movement. Currently on any medications or not. Addictions, diet, and menstrual history. Family history. Genetic diseases, hereditary diseases, diseases that run in families. Ask for any history of following diseases in family: squint, congenital cataract, ptosis, and glaucoma. And in the end, to summarize. Preliminary data. Chief complaints. History of presenting illness. Negative history. Treatment history, for presenting illness. Past history. Personal history. And family history.